The next lesson we're going to look at is the life cycle of the tooth. A tooth actually begins as a little tiny, what we call a germ of a tooth, just a little tiny bud, and then it grows, develops, and becomes a tooth, and then erupts into the mouth and is used for function, and then begins to wear down. So that's the life cycle of the tooth. Before we talk about the life cycle of the tooth, though, I'd like to look at this chart of the tooth anatomy. It's a review for some of you, and it's somewhat a little bit of new information for other students. A tooth consists of the crown, which is the part that you can see in the mouth, and the root, which is the part that is in the bone. Remember, we talked about the alveolar process when we talked about the skull and the face. Well, the tooth root is nestled into or rooted into that alveolar process. Excuse me. This is the bone here, part of that alveolar process. On the crown of the tooth, there's different materials the tooth is made up of. What we consider tooth-colored white part that we brush, that you can see, that's visible, is the enamel. It's a very hard substance. Inside of that enamel, or underneath the enamel, if you were to cut away the enamel, you'll find a big portion of the tooth is made out of something called dentin. In this slide, it's spelled dentin with an E. Many times it's spelled dentin without the E. In most of this lecture, I believe it's spelled without the E, but it's basically the same word, or it is the same word. So dentin makes up the bulk of the tooth. In the very center of the tooth is the pulp. And the pulp has the blood supply and the nerve tissue in it so that it allows the tooth to stay alive and healthy, and it also allows the tooth to feel, the person to feel it. Those blood vessels and nerve vessels exit through a little tiny foramen at the apex or tip of the root and travel along the face. On the outside of the dentin on the crown portion is enamel, as I already said. On the root, it's covered with something that's called cementum. So there's just a little coating along here that covers it. So it's not just the dentin, there is a covering on there. The tooth is in the bone, but it's in the bone it's not like rubbed up against the bone. There's actually ligaments along here, just like you have ligaments in other parts of your body. So there's ligaments here that are called periodontal ligaments, and those hold the tooth in the socket, and they also allow the tooth to give a little bit so that as you chew it doesn't break off. It kind of moves. The gums or gingiva are the skin part that you see nestled up, sort of like a turtleneck around the tooth. As we go along looking at the life cycle of the tooth, we'll talk about when some of these different parts of the tooth begin to develop. The life cycle of the tooth starts with the growth of the tooth, the initiation, proliferation, histodifferentiation, morphodifferentiation, and apposition. Those are the different stages as the tooth itself forms and begins to look somewhat like the previous slide. The next phase is calcification, and that's when it starts to harden so that it's hard enough for use, for chewing. Eruption is when it comes from within the bone and actually erupts into the mouth for function. And attrition is the last stage. That's when the teeth have been in the mouth for many years and they start to wear, just from being worn out from being used so much. Odontogenesis is one of those big words. It's actually two words that are put together, but the big words that I mentioned for dentistry. Odonto always refers to tooth, and genesis is beginning. So this is beginning of the tooth, or we can translate that to tooth formation. That's what we're talking about here. The life cycle of the tooth is odontogenesis. At the beginning, we talked about the primary embryonic layers being the ectoderm, mesoderm, and endoderm. Teeth are formed from the layers of the ectoderm and the mesoderm. During the 5th and 6th week in utero, tooth development actually begins. So that's about 1 month, 1 to 1.5 months into pregnancy. Sometimes people don't realize they're pregnant yet, but already tooth development is starting. Between the 4th and 5th months, in utero, permanent teeth begin to form. So before a baby is even born, there are permanent teeth forming in their mouths, in the gums, or in the bone. The way the teeth form and erupt, the pattern or progression is that the mandibular anterior teeth start first, then the maxillary anterior teeth develop, followed by the posterior teeth, and they progress distally, so they start from the midline and work their way back. Formation is complete at birth, but nothing has erupted yet. It's very unusual for a baby to have teeth until they're maybe the 4th or 5th month after birth. But at birth, the teeth are formed. There are 10 maxillary and 10 mandibular primary teeth formed, and 20 permanent tooth buds up through the first molars have all been formed at birth, by the time the baby's born, waiting to erupt upon certain schedule that the body knows. This is just some pictures. We're going to go through and talk about the different things. So I'm not going to talk too much about these pictures right now, but it does show you the stages, A through F, of different stages of development. So stage 1 was growth, and initiation is the first step in growth. This is where the tooth germ forms, and that produces the tissues of the tooth. If you think about a seed, if you've ever planted a flower seed, it starts out with just the seed, and then things start to grow from it. At first it doesn't look at all like the plant, but things grow and form, and it begins to look like leaves. That's sort of what the tooth is doing. This initiation stage is sometimes called the bud stage because it's just the very beginning of the tooth. It's just the bud. There is a narrow band of epithelium, which was the type of tissue. The primary dental lamina thickens and grows downward into the underlying tissue. This occurs at 6 to 7 weeks. So right here, this is starting to thicken and grow down. A is the enamel organ. Do you remember that we saw something about the enamel? So this is the enamel. B is the dental papilla, and C is the dental follicle. Different things that are names of the part of this tooth as it's forming. From initiation, we go to proliferation, and this is when the cells are starting to become specific tissues. The tooth bud enlarges to become the enamel organ, and then that later becomes the enamel of the tooth. This is called the cap stage. The connective tissue becomes the dental papilla, which then forms the dental pulp and the dentin. I showed you where those were on the tooth when we looked at that first slide. Surrounding the papilla is a dental sac. There's a little sac around here, which forms the periodontal ligaments, the cementum, and the alveolar process. This occurs from 9 to 10 weeks in utero. Now this is one tooth we're seeing, but of course it's happening with several teeth at a time. Here's your tooth anatomy again. We've already described the enamel, the dentin, and the pulp, and the alveolar process, and the periodontal ligaments. Histodifferentiation is the next stage of growth, and that means development of different tissues. So this is when the cells increase in number and they form different layers of tissues. It's called the bell stage. So we had the bud stage, the cap stage, and now this is the bell stage. Those words sort of describe a little bit of the description of what the tooth looks like. There are specialized cells that develop during this phase. Ameloblasts develop. Those types of cells form the enamel. Odontoblasts form the dentin, and this occurs between 11 to 12 weeks. This is sort of starting to look a little bit more like a tooth. A suggestion of a tooth, anyway. Morphodifferentiation is now there's going to be different forms that are shaping up from the cells. As the tooth germ develops, surrounding areas of the jaw are also developing. Remember, we saw those little ET looking characters or pictures back when we looked at the embryos, and we saw that there were different, the maxilla and the mandible and nerves and blood vessels were developing also. So this is happening around in the jaw where the tooth germ is developing. The tooth begins to take the shape of a crown and root during this phase. At the 5th month, the hard tissues of the tooth form. Now the hard tissues of the tooth are the enamel and the dentin. The progress is first the dentinogenesis occurs, which is formation of dentin, and then the amelogenesis begins, and that's formation of enamel. So it's in that. So the dentin occurs before the enamel. Here's your morphodifferentiation. The odontoblasts are creating the dentin, and the ameloblasts are creating the enamel. And it's starting to look, here's your crown, and here's the root structure. You're starting to see more of a tooth shape. This, of course, is still all the bone, and this is the sac, the dental sac. And here's a cross section of the amelogenesis and dentinogenesis. The amelogenesis is the enamel, it's the outer layer, and it's very hard. The dentinogenesis creates the dentin. It's got these tubules that go down towards the pulp, so this is the structure. The next phase of the growth stage is apposition. This is where the enamel and dentin increase in layers during the final stages. So they kind of build layers upon themselves until the tooth is completely shaped. The shaping begins at the occlusal or incisal edge and progresses apically in layers. That means towards the roots. So first the crown is formed and then the roots. You can see in these different, in this x-ray, this is the tooth. Here's the crown with the enamel. The really white part is the enamel. The grayish part is the dentin, and then the black part is the pulp. So here we have a crown, and then we have the root, and it looks pretty much like a tooth. This is the first molar. The second molar here has the crown, and you can see the enamel and the dentin, and just little legs, almost like little tadpole legs, coming off as the roots. So the crown is formed before the roots. In this last one, which is the third molar, the wisdom tooth, here's that dental sac, and here's just the tooth bud itself, and it's really just the crown right now. It's really far stages behind, so the teeth don't all grow at the same time. Remember, at birth, this tooth is completely formed. But these two teeth are not yet. These are permanent teeth. Stage 2 is calcification. Once that enamel and dentin have formed, the matrix calcifies. This means that the ameloblasts have completed forming the enamel. It's hardened. Enamel, once it's formed, can no longer regenerate or repair itself. So the enamel that you have on your teeth is all you're going to have. If you have damage to that enamel, you're going to need some sort of a restoration or a crown to replace it. Dentin does reproduce at any age to form something that's called secondary dentin, but it does harden at this calcification stage. Stage 3 is eruption, and this is when the tooth passes through the bone and the oral mucosa and right into its proper place in the oral cavity. Now, when this happens, the root of the tooth isn't completely developed before it erupts. It continues to develop after eruption. So what happens is that the tooth erupts, as this tooth has right here, but the roots have started forming, but even as it grows into the mouth, those roots are going to get longer and come down into a little point like this, which is called the apex, or the tip of the root. The first set of teeth that erupt are the primary teeth, and there are 20 of those. Primary teeth, 1, 2, 3, 4, 5 in each quadrant, and that's 4 quadrants, so that's 20 primary teeth. At birth, there are also 20 permanent tooth buds formed. Okay, they're formed either below or above the primary teeth or distal to the primary teeth. So these are all the permanent teeth through the second molar that are formed. The final stage is attrition, and this is where the occlusal or incisal surfaces wear away just during normal function. It's an aging process. You can see on these teeth that now the enamel is actually worn away. This darker brown that you're seeing is the dentin that's showing through because the patient has worn these teeth down, either from aging and just using them, or perhaps from habits such as a pipe smoke or smoking a pipe and rubbing against it or something. But this is the final stage here.